Well, you heard there about the NHS in crisis. Now the Health Secretary has pledged to spend up to £200 million to buy thousands of extra care home beds in England. The idea is this will help speed up the discharge of hospital patients to free up beds for new patients arriving. But as Catherine Nash reports, those on the front line say this is just a drop in the ocean.
All too familiar scenes in the NHS in England over the past few weeks. But today came the details of the Health Secretary's plan to alleviate some of that pressure.
Mr Speaker, today's announcement provides a further £250 million of funding, which recognises that the spike in flu, on top of COVID admissions, on top of high delayed discharge numbers from the pandemic, will provide immediate support to reduce hospital bed occupancy and decompress A&E pressures, and in turn unlock much-needed ambulance handovers.
But despite the promise of money for care home beds to help speed up the discharge of patients stuck in hospital, for those who run care homes like this one in Hertfordshire, the plan has been met with scepticism.
Sounds lovely on paperwork. I honestly can't see it happening in reality. Everyone knows the crisis social care faces with staffing levels. I'm sure providers would like if they have empty beds, but as you know, B&M as a company, we wouldn't have enough beds to fill those positions. There are 13,000 people apparently stuck in hospital. It's another kind of cork, isn't it? Keeping the water. No, I can't see it working.
As the government's announcement also includes money for hospitals, those on the front line say that won't make a big difference long term, as workload pressures continue to grow and staffing levels shrink.
It destroys their enthusiasm for work, and people burn out, people stop, people reduce their hours, they go less than full time, or people take a sensible decision to go, and they are in large numbers.
While the government hopes this investment will help ease pressures across the board, health bosses are warning that it's merely a sticking plaster and the future of our healthcare system is still in doubt. Catherine Nash, 5 News.